For those born before 1955 or living with a disability, it is that time of year to choose your 2020 Medicare plan. Whether you're eligible to enroll in Medicare, wanting to change your current plan, or maybe helping a family member or friend find a plan, you can use the annual election period, which runs from October 15th through December 7th to make that decision. Steve Stegman of Humana, he is here to share the valuable information that you need when choosing your 2020 Medicare plan. Okay, so let's get right in.
Okay,
let's start
Susan,
with the
let's
basics.
do this. All right.
How do we know if we're eligible for Medicare?
Well, typically if someone's 65, they're going to get their Medicare Part A and Part B. If they're still working, they might delay that B. Or there's a lot of people that are under 65, but they've been granted disability, and they become eligible for Medicare.
So what if someone's already in a Medicare plan? Do they have to re-enroll?
So not in Medicare itself. Once you do your A and B, you're good. But again, it's the annual election period, so this is that time of year when they're going to take a look at all those options for next year and see what they'd like to do.
And that's that word option.
Options.
Choices. There are so many available.
Yeah.
So how do we know which plan to choose?
Yeah, so, and everybody's health care is different. Husbands and wife might be different when we're sitting with them. The cool thing is there's so many choices with how they want to bundle it. They can do original Medicare. They could put a Med Sup with that, Medigap policy, if you will, put a Part D prescription drug plan in there, or they could go with the Medicare Advantage plan, which is gaining in popularity. They're really great plans that offer all the basic Medicare things that you want or are entitled to, but they're going to put a lot of extra things in there like dental, some routine dental, vision, maybe transportation, over the counter. Just a lot of extras that we build into a Medicare Advantage plan to just help enhance your coverage and give you more things, more options.
Incentivize it for you. I like that. All right, so is there anything new this year? Because that's always the question people have that they need to be aware of with Medicare.
Sure. So CMS, which is kind of the governing body of Medicare, the Centers for Medicare and Medicaid Services, is really putting a lot of focus on what we call social determinants now. And you've probably heard this. It's everywhere in the press. Maybe food insecurity, housing, transportation. Do you have access to medical care and some dental care and just things like that. So I would say they're not only allowing but encouraging companies like Humana and other carriers to really start looking at what else can we put into these plans to help people just reach their best state of health and well-being. Right?
It's so important.
It is absolutely so vital.
When all of those choices come up, it's also overwhelming.
Yes.
So how do we make sure, Steve, that we pick the right plan for us?
Yeah, and that's when you're, of course, again, we're right in the annual election period. So this is that time of year where we're reviewing all year. What did you do this year? What did you have anything come up? And then you're just going to look at your plan and say, okay, how's it working for me? Well, I have my PCP. Things are good there. My scripts are being handled fine. I'm okay with the co-pays. I think I'm okay. In that case, you're just going to stay on that plan and you can roll right into the new year and you'll be on that plan. But there might have been some things or just some stuff that came up. You're like, I think I might need to look at something else, maybe with some different co-pays. Maybe my doctor gave me a new script that I need to look somewhere else and say how it's covered. It might be a little expensive here, maybe it's less over there. So this is that time of year where I might pick that new plan to be ready for January 1st going into next year.
And we really want to stress those deadlines when selecting that 2020 Medicare Advantage or prescription drug plan, right? What are those deadlines?
Yeah, so it's already started. We're right in the middle, right? And it does end, like you said, December 7th. December 7th at midnight, the annual election period for next year is over.
And it cuts off at midnight. So please don't miss that deadline. Thank you so much.
Absolutely.
Great information.
Truly my pleasure.
The best way to find out more about Humana's Medicare Advantage plans, you have to call 1-800-345-8017. You can also visit the website. It's very useful, humana.com/Medicare to view their plan options.